Are you experiencing hip pain and you're unsure what to do about it? How do you know if this is serious or not? And how do you know whether or not you should see a doctor? Hi, I'm Dr. Marc Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of non-operative regenerative solutions. How do I know what is causing my hip pain? What is the actual diagnosis? And how do I know if this is serious enough that I need to see a doctor? Stay tuned and I will answer these questions for you. So what causes hip pain? There are a number of different problems that can cause hip pain, from more milder problems such as just bursitis, to sports injuries, to more severe problems like arthritis, or even structural problems, which are things that you may have been born with. So let's talk about these various conditions. Bursitis is due to inflammation of fluid-filled sacs that help to protect the hip joint. This can happen from minor falls, from smaller injuries, or from more serious conditions. Usually bursitis can be treated very simply with the correct exercise program or a quick procedure to help with that problem. Injuries are very common with hip problems. A fall can be very serious to the hip, even causing a fracture, or hips can be injured playing sports. These injuries can lead to minor problems such as strain and sprain injuries, or they can be more severe, even damaging the cartilage or, worst case scenario, breaking the bone inside the hip joint. Arthritis is a very common problem of the hip joint, especially as we get older. Most often, this is due to wear and tear, but can be precipitated by prior injury, by structural abnormalities, or even by prior surgery. Structural abnormalities are due to congenital deformities that people are born with. A common one is called a cam deformity, where the head of the hip joint does not fit well into the socket of the hip joint. Usually this can lead to other problems such as arthritis or bursitis, and can often require surgery to correct the problem.
Hey, I'm sorry for interrupting this video. This is Dr. Lieber, partners of Dr. Sally, and I just wanted to reach out to you just letting you know that if you're in pain, you're welcome to call the number that's listed below so that we can help. Now back to Dr. Adelsheimer's video.
So how do I know if my hip pain is serious? If you are experiencing pain following a fall, it is a serious problem. It needs immediate evaluation. If you can't bear weight on your leg, you need to go to a hospital and see a physician, because this may be a fracture and needs to be addressed immediately. Additionally, if there is any warmth or swelling around the joint, this needs to be evaluated, because this could indicate a bigger problem inside the joint, such as infection or significant trauma. So if you're having difficulty walking or putting weight onto your affected leg, you should see a physician quickly to have this evaluated. So what about more chronic problems? When do you need to see a physician for that? If you're experiencing pain every time you get up, if you're experiencing pain when you're trying to sleep, if you're experiencing pain when you're trying to walk, or if you're experiencing a lot of tightness or soreness in your hip joint, you should be evaluated by a physician. If the pain doesn't go away in a week or two, this is something that should be evaluated. You need to see a physician who has expertise in musculoskeletal medicine and can accurately diagnose the problem, so we can come up with solutions for your particular problem. It is important to be seen earlier rather than later, because the best solutions for hip problems are not ones that occur when we let this problem linger and become a chronic issue. So when you're looking for a physician, what am I looking for? First and foremost, you're looking for someone who has expertise in musculoskeletal medicine. You don't want to see a physician who only has one possible treatment option for you. There are many treatment options for hip problems, starting with basic and non-invasive treatments such as medications, physical therapy, and local modalities. If hip problems are more severe, injections can be performed, and in most severe cases, surgery can be an option. So when you're looking for a physician, you want to look at someone who has multiple options for you and not just one opinion. Often people go to see a surgeon for their hip problems and they do not talk extensively about other options, and surgery should often be the last resort. Here at Regenexx Pittsburgh, we have multiple options for your hip pain, beginning with conservative treatment and moving on to interventional treatments. If surgery is necessary, we are happy to refer you to a surgeon, and we will let you know that this is your best treatment option. So say you suffered a sprain and strain injury in your hip and you have undergone conservative treatment, including activity modification, physical therapy, stretching, anti-inflammatory medications, and you're still not getting better. Here at Regenexx Pittsburgh, we have a great solution for this problem. Most likely this is due to underlying bursitis and tendinitis that isn't improving, and PRP, which is platelet-rich plasma, which are your platelets that come from your blood, can help your body to heal this problem very easily. So if you've had ongoing pain that's been lasting for more than 2 months due to a strain sprain injury or due to bursitis, PRP can be an excellent treatment option for you. Chronic hip pain is pain that doesn't go away and last for more than 6 months. So if you have pain that has been lasting for more than 6 months, you absolutely need to see a physician who has expertise in evaluating and treating hip pain appropriately. So a lot of people come to see me and are complaining of hip pain when often that pain may actually be coming from their lumbar spine. Lower back pain and hip pain often go hand in hand, and one of the best ways of differentiating whether or not the pain is coming from your hip or from your lower back is where this pain is radiating. So if the pain is radiating into your groin, it's more likely to be coming from the hip, whereas if it's radiating into your buttock or down your leg, it's more likely coming from your lumbar spine. So someone who presents with hip pain, they need to have their lumbar spine and their entire lower extremities assessed appropriately to understand the root cause of the hip pain to come up with the best solution. So often the pain may be coming from the hip joint, or it could be coming from a lot of the supporting structures, such as the ligaments, tendons, and muscles, or even the lumbar spine with the associated nerves and joints around the lumbar spine. So there are a lot of low back conditions such as sacroiliitis, facet arthritis, sciatica, that can mimic hip problems, and often people think that the problem is coming from their hip when it's really coming from their lumbar spine. That's why it's really essential to be evaluated by someone who has expertise in both spine conditions and hip problems, so we can differentiate and provide the best treatment option for you. At Regenexx Pittsburgh, we take a comprehensive approach to addressing pain and making an accurate diagnosis to come up with the best treatment options for you. So we all remember the old nursery rhyme that the ankle bone's connected to the knee bone's connected to the hip bone's connected to the backbone. Well, here at Regenexx Pittsburgh, we know that to be true, and we evaluate the entire body to make sure that we are making an accurate diagnosis with your hip pain. Your hip pain may be coming from somewhere else. It may be coming from your ankle or your knee, or more commonly coming from your lower back. So it's very important to make an accurate diagnosis so we can come up with the best treatment solutions for you.